Hi everyone, welcome back to my YouTube channel. On February 1st of 2023, CMS released a fact sheet on 2024 Medicare Advantage and Part D Advance Notice. Today's video is all about that fact sheet. Let's get started. On February 1st of 2023, the Centers for Medicare and Medicaid Services, or CMS, released the calendar year 2024 Advance Notice of Methodological Changes for Medicare Advantage or MA capitation rates and Part C and Part D payment policies, the Advance Notice. CMS will accept comments on the calendar year 2024 Advance Notice through Friday, March the 3rd, 2023. CMS will carefully consider timely comments received before publishing the final rate announcement by April 3rd, 2023. Net payment impact. The chart below indicates the expected impact of the proposed policy changes on Medicare Advantage plan payments relative to last year. Let's go over year-to-year percentage change in payment. The impact on effective growth rate will be 2.09% with 2024 advance notice. Rebasing/repricing, the impact is to be determined. Rebasing/repricing impact is dependent on finalization of the average geographic adjustment index and will be available with the publication of the calendar year 2024 rate announcement. Change in star ratings, the impact will be minus 1.24%. The 2023 star ratings used for 2024 quality bonus payments that were made public in October 2022 are on average lower than the 2022 star ratings, while the circumstances for particular contracts differ. An overall decrease in the star ratings is to be expected because the adjustments for extreme and uncontrollable circumstances due to the COVID-19 public health emergency are not included in the 2023 star ratings for most measures, and there were additional methodological changes from the prior year. The impact on Medicare Advantage coding pattern adjustment is 0%. On risk model revision and normalization, the impact is minus 3.12%. On Medicare Advantage risk score trend, the impact is 3.30%. The underlying risk score trend is the average increase in risk scores, not accounting for normalization and Medicare Advantage coding adjustments, which are shown in separate rows. Individual plans' experience will vary. Expected average change in revenue will be 1.03%. Growth rates. The effective growth rate reflects the current estimate of the growths in benchmarks used to determine payment for Medicare Advantage plans. This growth rate is largely driven by the growth in Medicare fee-for-service or FFS per capita cost as estimated by the Office of the Actuary. Included in the 2024 growth rate estimate is a proposed technical correction to the per capita cost calculations related to indirect and direct medical education costs associated with services furnished to Medicare Advantage enrollees. This correction results in a one-time adjustment to the growth rates. Part C Risk Adjustment Model Revision. CMS is proposing a revised Part C Risk Adjustment Model. The proposed model includes important technical updates, including restructured condition categories using the International Classification of Diseases ICD-10 classification system instead of the ICD-9 classification system, and updated underlying fee-for-service data years from 2014 diagnoses and 2015 expenditures to 2018 diagnoses and 2019 expenditures, as well as revisions focused on conditions that are subject to more coding variation. The proposed new risk adjustment model reflects more current costs associated with various diseases, conditions, and demographic characteristics, takes into account the ICD-10 diagnostic classification system, that has been in use for medical payment since 2015 and includes revisions designed to reduce the sensitivity of the model to coding variation. The advance notice contains detailed descriptions of these updates. Inflation Reduction Act of 2022 or IRA updates for 2024. The IRA or Inflation Reduction Act of 2022 made several amendments and additions to the standard Part D drug benefit defined in the Social Security Act. The Part D benefit-related IRA updates that will be in place for calendar year 2024 and that are described in the advance notice include: beginning in calendar year 2024, cost sharing for Part D drugs will be eliminated for beneficiaries in the catastrophic phase of coverage. Beginning in calendar year 2024, the Low Income Subsidy Program or LIS under Part D will be expanded so that beneficiaries who earn between 135 and 150% of the federal poverty level and meet statutory resource limit requirements will receive the full LIS subsidies that were prior to 2024 only available to beneficiaries earning less than 135% of the federal poverty level. During calendar year 2024, Part D plans must not apply the deductible to any Part D covered insulin product and must charge no more than $35 per month supply of a covered insulin product in the initial coverage phase and the coverage gap phase. During calendar year 2024, Part D plans must not apply the deductible to an adult vaccine recommended by the Advisory Committee on Immunization Practices and must charge no cost sharing at any point in the benefit for such vaccines. Beginning in calendar year 2024, the growth in the base beneficiary premium will be capped at 6%. The base beneficiary premium for Part D is limited to the lesser of a 6% annual increase or the amount that would otherwise apply under the prior methodology had the IRA not been enacted. Please note that IRA provisions that take effect in 2025 and beyond will be addressed in future advance notices and rate announcements. Puerto Rico. The proportion of Medicare beneficiaries who receive benefits through Medicare Advantage as opposed to Medicare fee-for-service is far greater in Puerto Rico than in any other state or territory. The policies proposed and under consideration for 2024 would continue to provide stability for the Medicare Advantage program in Puerto Rico and for Puerto Ricans enrolled in Medicare Advantage plans. These policies include basing the Medicare Advantage county rates in Puerto Rico on the relatively higher costs of beneficiaries in fee-for-service who have both Medicare Parts A and B and applying an adjustment to reflect the propensity of beneficiaries with zero claims. Part C and D star ratings. In the advance notice, CMS provides information and updates in accordance with the star ratings regulations at 422.164, 422.166, 423.184, and 423.186 of Title 42 of the Code of Federal Regulations. In addition, CMS solicits input on future measures and concepts as CMS continues to enhance the star ratings over time. Star ratings updates for calendar year 2024 include providing the list of eligible disasters for adjustment, non-substantive updates to several measure specifications, and the list of measures included in the Part C and D improvement measures and categorical adjustment index for the 2024 star ratings to be issued later this year. CMS is also soliciting initial feedback on potential substantive measure specification updates, new measure concepts, and the addition of measures to align with other CMS programs. Specifically, across their CMS quality rating and value-based care programs, where applicable, CMS is considering including what CMS is calling a universal foundation of quality measures, which is a core set of measures that are aligned across programs. Process. Comments on the proposal set forth in the advance notice must be submitted by Friday, March the 3rd, 2023. The final 2024 rate announcement will be published no later than Monday, April the 3rd, 2023. To submit comments or questions electronically, go to www.regulations.gov, enter the docket number CMS 20230010 in the search field, and follow the instructions for submitting a comment. You can view the 2024 advance notice by going to the link which I have pasted here on this slide and selecting 2024 advance notice. The two links that are present on this slide can also be found in the description box below. This is it for today. Thank you for joining me. If you found this information useful, please consider subscribing to my channel and leave me a few comments. Hope to see you next time. Bye now.